Good afternoon, everyone. It is 4 o'clock, and I want to be respectful of everyone's time, knowing that some people may be signing on here momentarily. My name is Will Cook. I'm the president and CEO of Vail Health, and I welcome you all to the 2024 State of Vail Health. For those of you who are new to the event, this gives us an opportunity to have some two-way dialogue about what's happened in the last year at Vail Health and what do we see as we peer out across the waves, and to answer some questions, some of which were sent in advance of the presentation. Thank you for those of you who did that, and some that will be done through the Ask Question function at the bottom of your Zoom. So without further ado, let's go ahead and get started. Next slide. Thank you, Christine. So we try to start everything we do with looking back to our mission and vision. It truly is our compass. It informs all of the work that we do. And while I'm not going to read every single word of both, I do want to make sure you understand that our mission of elevating health across the mountain communities we serve is foundational to all the things that are happening from a strategic perspective, from an operational perspective, from a financial perspective. And we really can't achieve that mission or fulfill that mission if we aren't truly the leading healthcare system that's attracting the best talent across all positions to help advance our quality health for everyone in our community. So this is what guides us, and it's always a great way to level set. Let's go to the next slide, Christine, please. That mission and vision informs our pillars, and I've shared this with you in previous presentations, but again, for level setting purposes, that mission and vision and our corresponding values actually helped us to form our pillars, which are affordability, accessibility, population health, and sustainability. And while most of the time those four pillars are like four legs on a table that enable us to serve our community, there are times when all those legs aren't the same length. As an example, there's times when our desire to make things more affordable and more accessible aren't always consistent with sustainability, especially with challenges in retaining and recruiting providers and staff, and dealing with hyperinflation and all the things that I think we're seeing in every industry, but is hyper acute in the healthcare industry. We'll talk about that a little bit later, but those pillars really inform our strategy. But for us to be able to carry out and execute on our strategy, we really have to focus on our strategic enablers, which really at the end of the day, similar to our vision, is about people, which is really then about culture. And how do we make sure we stay focused on quality and process? Thinking about innovation and technology, our corporate and governance structure, which recently changed to reflect not just the changes that have been making internally, but what's happening externally. I'm not going to again read through every single one of these, but I think you get the gist of it. And this is really, really important as we talk about the rest of the presentation. Next slide, please. So again, most of you know Vail Health System, but I do think it's worth stopping and pausing because it's growing, it's changing. And each year, this slide changes from one year to next. Heck, it feels like it changes about every quarter, to tell you the truth. But the thing that's most important is we are an independent community healthcare system. We are a nonprofit. We don't send our margins or resources back to a front range system. We don't send it back to a national system. We don't send it to shareholders. We are here to serve this community. That's what our mission is all about. And I think that's what differentiates us. We're going to talk about that a little bit later. So what are the challenges of being independent, and how do we ensure that we remain independent? We have very strong financial performance, a strong balance sheet, good cash reserves, and that's resulted in our A bond rating. I'm probably most proud of what we've been doing in the space of quality, patient experience, and employee engagement. We're one of 429 hospitals in the country, and there's thousands of them that have both a leapfrog grade A for quality and safety and also 5-star CMS rating. That's a big deal. And it's a tribute to our amazing providers and staff and all the people who lean in every day to ensure that we're putting our best foot forward. We also are really focused on making sure that we are paying attention to patient experience, and we've been recognized 4 years in a row in our emergency room for being in the 95th percentile for patient experience. We don't always get it right, that's for sure, and we're constantly learning, but I want to make sure you understand there's a lot of things happening at this healthcare system that you don't always see at other smaller independent health systems. For example, we've given over $200 million to behavioral health. We are focusing tremendously on ways that we can solve the crisis of a lifetime, which wasn't COVID. It's in fact mental health and substance use disorder. So lots of things that we do here that you've heard me say before result, in my opinion, in Vail Health punching well above its weight class. Next slide, please, Christine. So again, for those of you who don't know, when we talk about the mountain communities we serve, it's not just the Eagle River Valley, but it's also Summit County. It's also the Roaring Fork Valley. Next slide, please. And we're hyper-focused actually on how can we in the process make sure we're collaborating with other providers who are in each of those markets, which I'm going to talk about here in a minute. But I want to make sure you understand that it's not just me that's saying that we're a great healthcare system. And I don't mean to sound braggadocious. I'm really just proud. I'm proud of everything that our board has done to enable us to do this. I'm proud of what the management team has done. And I'm most proud of our providers and staff and the community that supports us. Not going to read through every single one of these, but I want to make sure you understand these are things that I didn't get at some of my prior employment, where we had much larger systems. And so I'm incredibly proud of everything that we're doing. Let's go to the next slide if we can. One award in particular that I'm extremely proud of is one that our foundation recently received. In fact, they've received two here in this past year, but they received the inaugural Innovation in Philanthropy Award in 2023. And this award recognizes the outstanding achievements of a member organization implementing new and innovative ways to advance its mission and achieve greater impact that is both replicable and transferable to other fundraising teams. And I think that's the key here, because when you think about the behavioral health movement in this valley, that's not Vail Health, it's not us alone, that's everybody in this community. It's our municipal governments, it's our state government, it's the federal government, it's our elected officials, it's other nonprofits, it's law enforcement, it's education. It's so many people who said, hey, enough is enough and we've got to lean in and figure this out. And as part of that, raising money was a way that we ensured that we were maximizing every dollar that was out there, being efficient as we possibly could be. I'm so proud of what our foundation has done. They've raised, 88 of the $100 million, thanks to incredibly generous philanthropic community, thanks to missions that really call to people. And a quarter of that, almost 28 million has gone to non-Vail Health nonprofits to support them, because you can't leave some of these vital resources that are operating on shoestring budgets behind. So proud of the foundation, so grateful to our community. It really is all about community impact, collective impact, I should say. Next slide, please, Christine. Having said all of that, I don't think there's an industry in the world, and definitely healthcare is one of them, that has not felt post-pandemic struggles, in part from an aging population, and that's everywhere, which means more people are retiring, which means there's less people in the workforce. You throw in hyperinflation, you throw in volatile markets, and next thing you know, you've really got very, very difficult financial circumstances. And in healthcare, and especially in Colorado, there's been a lot of legislation aimed at reducing the cost of healthcare, increasing transparency, and making pretty fundamental changes, some of which we earned. I do not at all pretend to say that there was an opportunity to improve in healthcare, but some of which has had some unintended consequences, which actually puts more pressure on independent hospitals, and we'll talk about that here in a little bit. But all of this is to say that as a result of the downward pressure on reimbursement, the upward pressure on expenses, mostly from regulatory burden, the aforementioned great resignation, and the dependence on very expensive temporary labor, it really made the healthcare industry, especially in Colorado, struggle. As you can see from this slide, about 70% of Colorado hospitals now have unsustainable operating margins, and most of those are the independent hospitals that are located in rural areas. I'm not going to read through all of it, but again, expenses are up, significantly up, and they're outpacing revenue. And that's the piece that's not sustainable. Let's get to the next slide, please. More specifically, as it relates to rural and independent hospitals or health systems, we have a unique scenario that makes it extra challenging for us. We typically are in low population density areas. There's not a lot of people that live in our communities. And I know you're saying, whoa, we're 50, 55,000 and growing, but when you think about the incidence of disease, it's typically cited in per 100,000. And while I'm not at all wishing for us to get sicker or to have more disease, I'm just saying, as an example, that we only do about 100 to 120 breast surgeries every year. And that's because with 50,000 people in our valley, that's about the number of cases that result in breast surgery. Not to say that some aren't going other places, but most breast surgeons do about 300 cases in a year. And so the relevance of that is it's really hard to recruit just one surgeon, make sure that he or she has adequate backup so that they can have planned time off and unplanned time off, to ensure that they continue to keep their skill set sharpened. Most of them went to school for many, many years and went into debt so that they could do surgeries. And so it's hard to recruit and retain an N of one. And that's not specific to breast surgery. I'm bringing it up because it's been an issue here recently, and I've gotten a lot of emails and questions, and even one of the questions for the day is related to it. And I want to tie it back to the broader why. It's not easy to be able to have every single medical and surgical subspecialty in this valley, because we don't have enough population to ensure competency, which ensures quality, which ensures cost efficiency. Now, make no mistake about it. We have a great breast surgeon. Dr. Julie Barone came from St. Joe's. I recruited her from St. Joe's. She's amazing. What I'm saying, it's not about Dr. Barone. It's about the model. It's about the fact that if you don't have enough patients, if you don't have enough volume, if you don't have enough incidences of something, and you only have one person, you set yourself up for if that person leaves. You set yourself up for if something happens to that person. It's not fair to that one doctor from a burnout perspective. And this is applicable to cardiology, pulmonary, endocrinology, you name them. Other than orthopedics, where a lot of people get hurt on the mountain, there's plenty of volume for plenty of surgeons. It's a challenge, and it's not just a challenge for us. It's a challenge for Roaring Fork Valley. And we're going to talk a little bit later about some of the things we're doing to try and change the model so that we can, can continue to offer that care close to home. Again, remember, one of our pillars is accessibility. Another pillar is population health, which basically means how do we do a better job of proactively managing the population's health, in part by getting upstream to problems, right? So we're all in. We want to make it happen. We're just being forced, as we should, to figure out models that are sustainable. Does that sound familiar? That's also one of our pillars. So more to come in that space, but other challenges for independent healthcare systems that live in smaller communities is we don't have the revenue to cover the infrastructure necessary to remain independent. So no matter how big or small we are, you must have revenue cycle. You must have information technology, an electronic health record. You must protect against cybersecurity. You need to think about pursuing artificial intelligence. You've got to have HR. You've got to have finance. You've got to have supply chain. You've got to have legal. You've got to have compliance. You've got to have risk. All of these things require infrastructure that require money. And when you're only so big and you're running only so much revenue across those expenses, it's hard to make the numbers work. Again, I'll bring it up in a little bit later why that's relevant. But then lastly, we're geographically distant from other resources. So in other words, we're 2 hours away from Denver, depending on what time of day and day of week you're headed to Denver. We're 2 hours away from Grand Junction. And oftentimes the wind's blowing, it's snowing, pass is closed, we can't get a helicopter out of here, mudslides in the Glenwood Canyons. And that forces us to have even a higher level of clinical infrastructure, because it doesn't matter when it shows up in the emergency department and we can't transfer it out, we have a responsibility to take care of that patient. And that puts a lot of strain on our providers and staff, by the way. But these are the things that make us different than a large front range conglomerate like, I don't know, Common Spirit, Health One, UC Health, Intermountain. They're all great systems, by the way, and we partner with them all. I don't mean it disrespectfully. It's just a fundamental difference for why we've struggled more and others are struggling more. Now, before you get too worried, Yes, we saw our financial performance fall off the same cliff that everyone else's did. We've made significant progress in reducing travelers by really focusing on culture and enhancing our recruitment and our benefits and our comp. And proud to report that after our first quarter, we're actually back into positive operating margins. And while it's not where it was pre-pandemic, and by no means are we out of the woods, we're on the right pathway. And we are in part because we made tough decisions last year. And guess what? We're making tough decisions this year. And we're not doing it because we want to assemble war chests of funds or be inhumane to people. We're doing it because we want to remain independent so that we can continue to elevate health across the mountain communities we serve, so that we can continue to follow our pillars of affordability, accessibility, population health, and sustainability. So how might we do that? Well, I'm talking to Valley View, which is in Glenwood. I'm talking to Aspen. I'm talking to Grand River, which is in Rifle and Parachute. I'm talking to Front Range Systems, including Common Spirit that's in Summit County. I'm talking to anyone we need to talk to figure out ways that we lean in and share precious resources the way we've been doing with behavioral health. So more to come in that space, but I want to make sure you understand these are not decisions that are taken lightly. They're taken so that we can ensure you can continue to get high quality care close to home. Next slide, please. So some of that regional collaboration I just mentioned to you, I wanted you to have a picture if you haven't been to Dillon to see our Dillon Medical Center. And from some of our participants from Summit County, just want to take a moment to say thank you for joining us today. Thank you for embracing us in Summit County. While we've been there for years, we've had Howard Head and some oncology care and some primary care, and we've had orthopedics through our partners in the Stedman Clinic and Vail Summit Orthopedics and Neurosurgery. We built this facility to enhance our offerings there because many people from Summit County were coming to Vail to receive care. And again, we're trying to keep it close to home as possible because I'm sure many of you have been caught in that Vail Pass trying to get over it at some point and sitting on the side of the highway wondering what the heck are you doing. And so we're really proud of this new facility that's over there, and it's doing incredibly well. In Roaring Fork Valley, we are in a joint venture. The building in the bottom of the screen is the joint venture that we have with Aspen Valley Hospital, another independent. Dave Ressler, the CEO, and I are very close. We're constantly talking about ways that we can work with one another. Dr. Brian Murphy, our urologist who used to practice in this valley, is the CEO of Valley View. He and I collaborate constantly. Jim Combs from Grand River, all of us are saying, look, how do we lean in? And on the behavioral health side, that's a statewide collaboration because there's such a paucity of services, and we truly have emerged as a model for behavioral health at the state level. Next slide, please, Christine. So despite the financial troubles, which again, we're emerging from, and despite all the aforementioned challenges with people and hyperinflation, we have remained committed to this community. In fact, since I've been here, we've committed over $115.6 million towards community benefit. This is a tribute to our board. This is a tribute to our management team, our providers, and our staff, but also our community, who's been wonderful partners with us to figure out ways that we can do a better job of helping. Doesn't mean we can do everything. I get a call or an email once a week with someone who's struggling, asking for help. And while we want to help everyone, we have to be mindful that we too must protect our interests to ensure that we are here for the long term. And we have to also pick things that are really in our sort of core service area, if you know what I mean. But I do want to acknowledge that this community relationship, in my mind, is the secret sauce of everything that we've been able to accomplish. Without our community, none of this could happen. And I want to make sure you understand that the $60 million we committed to behavioral health and the $100 million we promised to help raise, which we're at about 90 million now, 88, I think to be exact, is not where we stopped. We've since broken ground on an inpatient behavioral health facility. I guarantee you there's not another mountain community this size in the country, if not the world, that is building a 28-bed inpatient behavioral health facility. I guarantee it. And I'm so proud of that because, again, it started as a community movement in our valley by everybody. We just had the privilege of being the backbone to help make it happen. So thank you all for that. Next slide, please, Christine. So recently we had an economic impact study done, and we did this for strategic reasons. We did it with other independent healthcare systems in the Western Slope, and we did it because we're saying, listen, we understand that healthcare needs to change. It needs to be more affordable. The value equation needs to be better. And we understand why legislation is happening. We actually are more aligned with Governor Polis and his team and all of our elected officials, because we believe it too. Just see the pillars I just cited to you. We are totally aligned with them. Now, does it mean every single piece of legislation we agree with? No, but I'm not sure there's any industry where that's the case. But there's unintended consequences. And we go back to the 70% of hospitals in Colorado struggling, the bulk of which are the independents. And those will actually, some will fall prey to the larger systems. Some will actually close. And that's not actually helping healthcare in the long run. That's actually hurting it. And so what we're trying to say is, in addition to being able to provide care locally so people don't have to try and traverse passes that are snow clogged, is that we are usually an economic force in the community. So I want to make sure you understand that we're trying to show there's major economic contributions that are being made by a lot of these healthcare systems that are in these communities, including ours. There was a study done, oh gosh, 10, 15, maybe 20 years ago, that included Stedman Clinic, that included some of our other provider partners to try and show the resort and medical destination business. And the number was actually much bigger than this. So when people come here to have surgery with Dr. Mark Philippon, as an example, who works for the Stedman Clinic, they are flying into the airport. They're staying in a hotel. Their family member that came with them is going to the restaurant. Maybe they're even skiing. And so there's an economic impact beyond just the healthcare impact. And we want to make sure that all of our elected officials know this and that you as a community know this as well. Next slide, please. So what's happened since February of 2023? Well, a lot's happened. In addition to emerging from the financial challenges that I alluded to before, we opened the Uyghurs Mental Health Clinic, which is a comprehensive outpatient behavioral health clinic. Let me tell you how important this is. Part of the reason we saw a disproportionate share of mental health and substance use problems in these mountains is because there was a lack of behavioral health, mental health providers. There was no one to see. The problem would fester. It's tough to live here, by the way. We're in a seasonal climate. A seasonal economy. The climate's tough. Housing's expensive. Daycare doesn't exist. It's multifactorial. But it was in part because there was no one here to provide care. A problem would fester. You'd get admitted to the emergency department where you were waiting to get into an inpatient unit in Denver, Grand Junction. They'd get you rehabilitated, send you back up here, and there's no warm handoff for you to see a behavioral therapist, for you to see a psychologist, for you to see a psychiatrist. And so the problem would fester again, and then it's rinse and repeat process. Not only is that incredibly ineffective, it's incredibly expensive. And so having a comprehensive outpatient behavioral health clinic that can do everything is so important. And I want to thank the Uyghurs family for their incredibly generous contribution to help make that happen. We're already planning to expand that. Currently, we're in the Edwards Community Health Campus, which many of you probably know as North Star, across from the Wendy's and the Shell station. And we're actually, moving to expand that because the demand has been off the charts. And we're thinking about full continuity. That's why we broke ground on the inpatient behavioral health facility. And it's called the Precourt Healing Center because Jay and Amanda Precourt gave so generously to make it happen. But this is for everybody. All of these services, this is for everybody. It doesn't matter if you have insurance, you don't have insurance, it's government insurance, it's commercial insurance. We are here for everybody. Everybody. We also launched the Shaw at Home program for in-home palliative care. We launched the Behavioral Health Innovation Center because we want to put science behind novel treatments like hot and cold therapy. The science, the data has shown that people with mental health issues actually run hot, like a car that runs hot. And if you heat them up, their body temperature, and then you put them in a cold plunge, it actually has therapeutic efficacy. Look, people have been doing this for centuries. If you haven't had a chance to listen to Dr. Chuck Raison, the scientist that we recruited from University of Wisconsin at Madison, talk about this, I encourage you to. A little bit later in the Q&A session, we're going to tell you about some learning sessions he does on a periodic basis, and I would highly encourage you to do it because guess what? He's also one of the fathers in research related to psilocybin. which is the ingredient that you find in magic mushrooms, if that's what you know them better as. Now, are we going to be handing out shrooms and going on journeys? And no, that's not who we are. I have to tell you, Chris and I probably get calls weekly from people asking if I want to sell them some mushrooms. And I'm like, no, I don't sell mushrooms. But I will tell you, the science has shown that psilocybin, when used the right way and under the right circumstances, can reduce depression, PTSD, substance use disorder, not by 5%, but like by 60%. 60%. And the reason we want to look at novel treatments is the old way of giving people Xanax or some other type of pill. It works in some instances and maybe for some period of time, but not in the long run alone. And we don't want to recklessly get out there and be doing novel treatments without putting science behind it. Science. So again, the Shannon family so generously gave to help make that happen. We're doing our psilocybin treatments through the FDA in very regulated, very rigorous studies. We're going to make sure that every person who's in the study gets it, though, so that there's not a placebo, a salt pill or what have you, but it will be highly controlled because we think this will change the model of care. We're so excited about this and so proud of everyone who's been involved and so grateful to the donors who've given so generously to enable it to happen. No, everyone's going to ask the question, well, Will, where are you going to house all those people for that new inpatient behavioral health facility? Well, not all are going to go into our new housing unit at Fox Hollow on the south side of Highway 6 in Edwards, but some will, many will. 87 units, and I look forward to telling you about it in a subsequent slide. Christine, please. So these are centrally located in Edwards, deliberately done the same way that the Uyghurs outpatient facility and the inpatient behavioral health facility was strategically put in that location. This doubles our number of units that we have available from 93 to 180. And I'm again not going to read through each of these, but we broke ground in the spring of 2023. They're modular units, meaning they were built somewhere else where it's more affordable, driven in on trucks and literally stacked. And I want to take a moment to acknowledge Brett Grand Vacations. This was an amazing public-private partnership. Graham from there was so helpful to us. Craig Cohn from within our organization. I want to thank our partners from Eagle County, going through an entitlement process, trying to get these things CO'd and opened is not easy. And we get it, but we need every single person leaning in. And I want to thank all of those who've been involved to help make this happen. We've been doing lotteries, and I'm so pleased to say the first 12 units will be ready in about a month, maybe less than that. We'll be fully in by summer and fall of 2024. So excited for this. Next slide, please. Just to give you a little more detail, so currently we had about 93 units and we were subsidizing a tune of about $1 million. You add in the 87 units for Fox Hollow, that's about another $1.2 million. And that actually increases our subsidy on a current basis once those are, on a future basis once those open to about 2.2 million. And Fox Hollow represents 20% of the new affordable for lease inventory being constructed in Eagle County. Said differently, 1 in 5 of each of the things that are happening in Eagle County are because of us. And I don't mean that in a braggadocious way. I mean, it's a commitment. It goes back to that enabler of people. It's us trying to help solve for the problem of housing and doing it with partners, be it Brett Grand Vacation or Eagle County. And so we're very grateful to our board who has the vision to do these things, that helps get the resources. And we're very grateful for the partnerships. Next slide, please. Behavioral health progress. Look, if Harry Frampton is watching this, I'm going to get a call from him tomorrow. He's going to tell me I had too many words on this slide, and you know what? He's right. So Harry, forgive me, but it's hard not to write it all down. And the purpose isn't for you to be squinting your eyes or to try and figure it all out. But I want you to see that in 5 short years, we initially committed 60 million. Now it's 20 million plus. Right? We had limited local funding for behavioral health with no government funding or any financial sustainability. Now 93% of all community providers in this valley, except Olivia's fund, which is a fund that was created in honor of Olivia, who took her life at 13 years old because of mental health issues. We fought like heck to get the commercial insurance rates up in the behavioral health outpatient world so this can be sustainable, so we can scale this. We've gone after every single dollar we can from a federal grant, a state grant, new market tax credits, everything we possibly can to get every resource to make this work for everybody. Your Hope Center, oh my gosh, it's amazing. 17 behavioral health clinicians providing free services to students, with one in every public elementary, middle, and high school in Eagle County. A behavioral health clinician working alongside your traditional school nurse, your traditional school counselor in every single school, 17. That's amazing. And again, I don't have time to read through them all, but I'm so proud of you all, everybody. This is you. This is not just us. This is you. And you should be proud of it. And we're on a pathway. We're not out of it. We probably never will be. It's a disease just like cancer, but I'm so grateful to the progress that's been made here. Christine, next slide, please. So the Edwards Community Health Campus. Now, I took a picture of this beautiful shopping center because I remember when I got here and we bought it, and there was a liquor store and dog food store, you know, a little restaurant that had turned over a couple times, Subway, which I got to tell you is no longer there, and I used to eat there every day for lunch. And I'm not trying to make light of small businesses that were in there that worked so hard to get there. What I'm instead saying is when we bought it, we got accused of buying up real estate and going to use it for untoward purposes. And we tried to explain that, no, we have a vision. We have a vision of having a community health campus that's co-located in the Mid-Valley that'll have inpatient behavioral health services. People are like, what? Outpatient behavioral health services. What? Community services like the community food bank, like My Future, the community market, I should say, My Future Pathways, an after-school program for teens. Your Hope Center, the care management, and it's all near a bus line. This was all strategically done and for a reason, and we chose a Class B shopping center, no offense to the people who built the shopping center, because we knew it would be more affordable. Why not repurpose some of that for something that's good as opposed to letting it sit vacant or opposed to being a liquor store or something else? So proud of this and so happy to see it come together, and it still is growing and evolving. You'll continue to see more as we work our way through all of this. Next slide, please. Precourt Healing Center, here's some renditions of this. Not only are we going to be the only mountain community with 28-bed inpatient facility, so you don't have to have family members leave the valley when they need acute inpatient behavioral health care, but we're changing the model in the process. Every person will have their own room. It's unheard of. Every person will have their own room. It will involve exercise. It will involve diet. It will involve changing the whole person. The whole person. My mom and I got into a text exchange argument because in one of my articles, she saw that I spelled holistic WHOLISTIC, and she corrected me like she always does. She's an English teacher and said, no, well, it's HOLISTIC. I said, well, it's both, because we're talking about whole person care. We're talking about physical health. We're talking about mental health. We're talking about substance use disorder. We're talking about social determinants of care. We're talking about spiritual health. We're talking about it all because you need it all. She still corrected me and then sent me a link to a document saying that I was still wrong. So to my team, who I'm always correcting your work, I'm going to blame it on my mom. Next slide, please. So what's happening next? What do we see happening over the next year? Maybe 3 years, maybe 5 years. So we want to finish construction on the Precourt Healing Center. Craig and his team are doing an amazing job. I think that should be done end of 24. We're going to open up sometime in 25. I'm saying spring, and I'm not committing because we need to get an electronic medical record put in there. We need to hire the right staff and make sure we got the right housing, that we give it a chance to open up the right way. But that's right around the corner. This time next year, we'll be talking about, hey, we're weeks away, possibly months away. We launched our first behavioral study, and we will be launching our first behavioral study in April. Very excited about that. You heard me talk about it before. We've been talking with Blue Zones. I don't know if you've all seen the documentary on Netflix or if you've read the book, but this is about how do we leverage mountains, a community that is very health forward, that skins in the morning and rides their bike straight up hills and really is very active. How do we use that and leverage our resort community to pull people to want to come here to either for sports performance or longevity or healthy aging? How do we use Blue Zones and the marketing machine that it is and its playbook on how we can not just take care of those people, but other people in our community who struggle because they live in a crowded trailer park, or they worry about where they're going to get their next meal, or they don't have access to healthy food. So again, there's been this age-old phenomenon of a resort town using the money it makes from its visitors to take care of the people who live here locally. And we're hoping maybe we can get some traction with Blue Zones as well. Lastly, you heard me talk about longevity, healthy aging, et cetera. We want to continue to focus on a long-term pathway to sustainability. Someone asked a question about how are we funding our mission and our vision? And the answer is pretty straightforward. Like most businesses, you do it from cash from operations. What you don't have from cash from operations, you get from reserves that you built up deliberately to carry out strategic plans like this. You might borrow money. So when we built a hospital of the future that will last this valley for 40 plus years, that's a $300 million endeavor. 100 million was a bond, which is debt. A big chunk of the remaining 200 million was from our cash reserves. A big chunk of it came from philanthropic donors. And so those are the ways we're going to fund it. But because of the aforementioned headwinds and the great resignation and hyperinflation, we are going to have to be more efficient. We're going to have to make tough decisions, but we're going to use our mission, our vision, and our pillars to help us get there. So with that, we'll go to the next slide and say thank you to all of you for listening to me today, for taking time out of your schedule to talk with us. If you wouldn't mind, whoever is driving here, let's maybe take the presentation down so I can see what I can see. And let's get to the Q&A portion. I think, Sally, you were going to read some of the questions that were sent in advance. And I know there's an ask question function on the Q&A at the bottom of your screen. So, Sally?
Yes, Will. You actually addressed the majority of those questions that we received in advance. We received 3. The one you just spoke to was regarding the vision. And so let's see if we have any questions come in.
Let me just, one question I mentioned with Dr. Julie Barone, who is an amazing human being and a great surgeon. A communication did go out last week, late last week. Over 400 letters were sent, maybe it was via email, and we're tracking who's opened them. People followed up with questions. We will continue to offer breast surgery in this valley, and it will be a part of Vail Health and Shaw Cancer Center. And we've got interim and longer term plans in motion. I've been emailing with a lot of people, talking on the phone. More information will be forthcoming as we know more. So again, thank you for asking that question. Thank you for your patience and understanding in that regard.
Great. And we've had 2 questions come in. The first one is, how can the community help you realize your vision, mission, and key objectives? Is there an ask we can ask of others?
Oh, man. Thank you. Yes, you can, number one, as a group, continue to, where you feel enlightened and passionate, volunteer. It doesn't need to just be with us. My Future Pathways, Your Hope Center, whatever you, any nonprofit in this valley is an important part of our overall plans. If you haven't yet seen the Paradise Paradox, we'll try to provide the link to people in that regard. It's a wonderful film that talks about the disproportionate share of mental health issues in the mountain resort communities. Forward that on to other people. See if there's ways that we can further share ideas and scale this concept. If you want to, figure out other things that you can get involved in, please reach out and let us know. We can connect you with the right people. If you're someone who has the means and you want to donate money, please consider doing it. Probably the thing I'm going to ask for the most is grace and understanding and patience. Because as much as we want to be all the things that I've described to you, we can't do it all at once. We're going to have to make some tough decisions, and you're not going to like every single one of them. I know it. But I know that at the end of the day, if we all are leaning in, trying to make this a great place to live and work and trying to take care of one another, we're going to be fine. So thank you for that question. Thank you for all that you've done to date. If you want to talk more, you can get my contact info. I'd be happy to discuss it with you.
Okay, Will, next one. Please talk more about your plans to help the needs of our aging residents.
Well, I was emailing with somebody about that. I wonder if that's the same person who sent me the email. He's a dear friend and cares deeply about the valley. And I think the short answer is we've got to do some more work in that regard. Since our demographic is shifting, and that basically means people who are living here getting older, we've got to figure out what are the services that Vail Health can and should provide because it's within our sort of capabilities as a healthcare provider, and what are some services that are perhaps outside of that, right? And so lots of conversations have been had around, well, what are some specialties that are missing, like neurology, because people start to deal with dementia. We also have people who hit trees on the mountains on their skis and have concussions. So that's one area where I think we have opportunity. We really need geriatricians here. They're like primary care physicians with subspecialized, ability to care for people who are getting older. Those are we just did the Shaw at Home program for palliative care because palliative care doesn't necessarily mean you're dying, but it does mean that you are grappling with some pretty significant issues and you need some help in dealing with that. So that's an area where we're helping. An area where we are not home care, we are not a nursing home, we are not skilled nursing facility. We have partners in the community and hospice care of the valley. We have community partners in Castle Peak. There's things that we just don't have the knowledge base to do and won't always be jumping into things that are outside of our lane. We would instead like to figure out ways that we work with those local partners to help them, achieve their mission. So as an example, we send doctors and other resources to Castle Peak to help them. We send resources to Mountain Family Health Center. So lots of things that probably need to be done more. But this is going to be one where the entire community is going to need to lean in as well, almost like behavioral health. Other questions?
Great. Do you have any strategies to continue to deal with the uninsured in our community?
Absolutely. Glad you asked the question. And Chris Lindley, if I miss anything here, please jump in. You may all not know this, but we hired 3 bilingual enrollment specialists to help people who qualify for Medicaid get it, because some insurance is better than no insurance. And in the process, you typically sort of peel back the proverbial onion and run into things like, oh, they're having issues with housing, they're having issues with food, they're having issues with daycare. That's why, again, we created a care management department of Vail Health that again has bilingual folks in it, trying to get people connected to all the various nonprofit resources that are out there, government resources that are out there. Eagle County is a great partner in that regard. HICPUF, which is healthcare policy and financing, the state that does Medicaid, has been a good partner with us. So we're trying to do everything that we can to get the uninsured cared for. We give subsidies to Mountain Family Health Center. That's the local federally qualified healthcare center. We give them free space in Avon and in Gypsum. They have a new CEO, Dustin Moyer, who just started, and we're meeting with him soon to talk about ways we can further collaborate. Chris Lindley, anything you want to add there that I may have left off that's very germane here?
Sorry, I'm just trying to get my video off here. Yeah, no, Will, I think you covered it correctly. And, we're also working really hard with just other scholarship programs that are available, not only in our county, but also Summit County, and working to set up additional scholarship programs in Roaring Fork Valley. Anything we can do to make sure everybody has access to the top level care that we provide, we're interested in.
Thank you for that, Chris. Sally, want to hit us with another one?
There was a question about how you've expanded behavioral health resources in Summit County. Maybe that's a question for Chris.
Yeah, Chris, leave that camera on, buddy.
Yeah, absolutely. So right now we're doing a shared model with Summit County government, also Project Building Hope down there, as well as working with the local federally qualified health center, which is Summit Cares Clinic, and the Sheriff's Department. We have 4 full-time providers that are stationed out of Frisco. They're there on the Main Street providing services. But that community is also accessing all of our behavioral health providers that are housed in our Edwards office as well, both via telehealth and in person. So we're doing all we can to support the behavioral health needs down in Summit County.
You know, someone mentioned when we talked about helping out in the Roaring Fork Valley and helping out in Summit County, hey, wait a minute, we need to make sure our own valley is cared for. And we watch very closely the demand for our services and the supply. We've added, I can't tell you how many providers in a short period of time, and we look at days out to the next appointment, and we're constantly looking at that. And the reason we've been fighting to get commercial insurance rates up to what physical insurance rates are is so we can scale it, so that we can go to Summit and Roaring Fork. Because guess what? People flow in and out of those valleys. You know, employees do, patients do, providers do. And we've got, again, very limited resources, and we're trying to lean in to provide them together. And the more we can lean in, per my earlier comments, the larger the revenue base to then increase the expense base, which allows us to touch more people. And we love, our vision is to one day to be the provider of behavioral health services in the Western Slope. To have a model that's self-sustainable, to have a model that looks at novel care, novel treatments for care, that have a model that has outcomes that are different than what we've seen over the last 20 and 30 years. So that's why we're looking to grow that program. Other questions?
Great. We have answered all the questions that have been sent in. So we've answered a couple of the questions in the chat directly. And if we'll give a couple more minutes for some additional questions, and if not, we'll end the event early.
I've been known to ask myself questions, and all my group kind of laughs at me and rolls their eyes. I do sometimes talk to myself. But I just want to say something as people are thinking of any last minute questions. This is a once a year event, but it's not once a year opportunity for you to give us feedback or to get engaged with us or to, you know, hear what's going on. We are happy to share with you what we're thinking about doing, to share with you what we can't. You probably know many of us, we see each other in the grocery store. We see each other at fundraising events. We sit across the table from one another in board meetings. But please don't hesitate to reach out to me directly. I'll be happy to try and answer any questions that I can to any of you. Thank you for that. Thank you, Chris Romer. You are a huge partner. In fact, just a quick story. We had a wonderful story of how people came from the community, went through Career Rise, worked their way back over to us. We got a scholarship. They went back. They, grew in the ladder of our organization, went from care managers to behavioral health clinicians, and CMC was involved. And it's so wonderful when we see everybody, putting forward efforts and trying to build pipelines and help people grow their careers. Those are the kind of programs in my mind that are going to be the solution to our staffing problem out here. We grow from within. We lean on other organizations. So thank you, Chris, for all that you and your team does in that regard too. And a huge thank you to Colorado Mountain College, to Colorado Mesa, My Future Pathways, and so many people that have helped us find bilingual people who can help us with Medicaid enrollment. So thank you for the props. Thank you to all of you. Sally, are we wrapping up a little early, or we got a couple more questions?
We're wrapping up early. Thank you.
All right, everyone. Thank you. Be well. Have a great rest of your year.